What are the strategic priorities for the Defense Health Agency, DHA? How is DHA working to create a more fully integrated military health system? And what is DHA doing to deliver health care differently, expanding services and tailoring care? We'll explore these questions and so much more with my very special guest, Lieutenant General Telita Crosland, Director of the Defense Health Agency. I really wanted to get a sense of your key priorities. What are you focusing on today?
Yeah, so I'm focused on a couple of things as a director. I've got some great mentorship. We were just talking about mentorship, coming into a big job. That's one of the, I think, wins of the DODs. There is certainly a spirit of support and mentorship, even at the most senior levels. And I was given some good guidance that says no matter what your strategies and priorities are, if you don't understand the fiscal cycles, you won't move anything. So a core principle on everything I'm about to say to you is it's got to be done with deliberate speed. Deliberate meaning not reckless, thoughtful, deliberate, but with speed, which means I have to focus on just a few things. Mm-hmm. And I wrote out what we call a 90-day assessment, and I shared with all the key stakeholders, from everyone down to the deck plate, so in our hospitals and clinics, and it got circulation on the Hill. And in my 90-day assessment, those are the things I'm working on. The first is we've got to look at our fiscal model, how we're funded. We talk quite a bit about how much healthcare costs and so forth. And within our DOD is a big organization, big budget, but arguably a budget that does a lot for our country and the world. Mm-hmm. And I want to make sure that as a director that we are being good stewards of the dollars we get, but we also making sure we have enough dollars to keep up with that DOD mission. Right. And so that's one of the things we have been working on, is to making sure that we have a strategy that's resource and prioritized. The second is that I mentioned to you as we were transitioning, depending on your chair, that was a mammoth merger or a hostile takeover or, a startup, right? And then there were different thoughts. But at the end of the day, we had to organize to lead it. Yeah. And it was to get those 9 networks stood up and organized. And I'm really proud of the team. I became the director in January of 23, and we had those 9 networks stood up by 1 October of 23. Wow. Because you've got to invest in your people. You got to position them, give them support so that they can start to move. The third thing I talked about working on is modernizing our healthcare system. And we talked a bit through some of those initiatives and the principles behind speed. And then the fourth big one is we have an electronic health record. That was another major muscle movement that was percolating below the level. Okay, now it's 2024. How do we look at our EHR and modernize it? Not independent as its own thing, mm-hmm. but as part of a healthcare system now. Yep. and moving forward. And so to do that, you have to make sure you're running a healthcare system well, and you'll hear folks call that stabilizing the healthcare system, right? So that's getting the 9 networks, making sure we've got the right funding, priorities, and we're working on the right things, the virtual first strategy. The second line of effort, if you will, mm-hmm. is looking at the workforce and the talent management and all the things I talked about. How do we take care of our individuals that we have today? And so one of my key initiative is organizational well-being. We all understand where healthcare is, and I think the American people really got some insight and a ton of empathy for healthcare workers during the pandemic. But I will share with you that a lot of those stressors that just seem new to others were there, and the pandemic just really exacerbated it because the strain and stress just went to a new level. And with shortages and with the criticality of the profession and the industry, it's time that we actually, as an organization, and I imagine others who run healthcare systems think the same way, we take a deliberate look at mm-hmm. how do we support our workforce? How do we bring on talent? How do we develop them differently than I was developed? How do we pour into them, if you will, so that they are actually, I don't want them to be resilient and bad. I want them to thrive in their real environment and perform. Because their real environment is going to have stress, because that's what healthcare is. It's a stressful job. You got to be on point. You got to deliver. Think about what you're working. And most of us can thrive in that environment only so much. So let's work on the so much so that you can thrive. And then the last thing that we haven't talked much at is we're a combat support agency.
Yes.
DHA is a combat support agency. And what that means is as an agency, we provide support to our combatant commands across the globe whose job is to focus and make sure our nation's ready across the continuum of crisis, right? Competition, we call it first, before anything is happening. Crisis, which is where it seems like we live, pretty much, whether it be a hurricane, a pandemic, or civil unrest somewhere, to full-on conflict, all right? And so we have a responsibility to support the operational force through our combatant commands. And I have a whole team that works on just supporting our operational mission for those COCOMs.
One thing you brought up that I thought was really compelling is it's a technology thing, but it's more about the digital health tools you're fielding. Could you tell us more about the strategies you are pursuing around helping, take these digital tools to the providers and to the patients in order to catch something early or engage them to in their health rather than their illness? What are you doing in that area?
Yeah, so the thing we're doing like time now is we stood up, actually, it was this January in earnest, and remember that speed and deliberate. So we identified 5 of our facilities, and we called them venture sites: Wright-Patterson, Eglin Air Force Base, Portsmouth Naval Hospital, Jacksonville, and then Martin Community Hospital. And so and all on the east side, because we're mindful that we're an integrated system, which means as we do things, I'm not just thinking about the direct system, I'm thinking about the managed care support contractor, our TRICARE partners as well. And it's a little easier to work in one area. And so those 5 sites were like our incubators, if you will. We call them our venture sites. And we said, what if we redesign healthcare from the lens of a patient, and we executed a principle that says, I want to see you from wherever you are? What would it take to make that a true statement, right? And let's design it from the eyes of a patient. So here are some of our investments. One is, if I'm a patient and I can't do it from my phone, you're an F, right? If I don't want to go to a desktop, So we pushed ourselves. And I'm really proud. We pushed ourselves to leverage technology that exists in the banking and other industries to keep our medical information safe and compliant with the DoD and all the cybersecurities, such that now you can get a secure link on your phone. You opt in, which is an industry standard, and then I can establish an appointment with you on your phone that actually integrates back into your electronic record inside of a secure DoD system. All right, so that's one investment, and just proud of the team because we were nowhere near there, and here we are. We have it, it's working, and we're testing in those 5 sites. How do we have a virtual platform that connects to that? Was another investment, so that now the provider can open it up inside of there and with ease have that interaction with the patient. So ease on the patient side, ease on the provider side. And now it worked, right? I like to tell a funny story, but it's not funny. I fell a couple weeks ago, and my shoulder was bothering me, and I'm busy, and I have great health care, but I got to make time for that. And we launched the new secure video platform, and the guys out in Ohio, Wright-Patterson, Air Force, I'm Army, they say, man, be our first patient and test this. And I said, okay, let's do this. And sure enough, I went through that experience, right? I got a link to my personal cell. I touched it. I opted in. It said yes. And then I got another link that says, here's your appointment, 2 hours, reminder. I touched the button, and they took care of me virtually. And the beauty in it is a couple of things. The first is that was just the right thing to do for a human being. It made it easy for me to assess care. I stopped delaying because I saved about 3 hours, right? Rather get an appointment. And I run the system, so it's not like I can't get the appointment. But I still would have to break away from my office. My clinic is at the Pentagon, get seen, and then drive back. We're all on the same electronic record. So they were able to – it didn't matter that it was an Air Force facility because docs are docs, PAs, we're quality, great help, and it was seamless to me and to me and to them. That's key. This needs to not be on the backs of the clinicians. Technology on the back of the clinicians is not very helpful. So that's an investment in a very and now we're ready to scale that because, again, we run a large system. And so having good ideas that we're unable to scale is not a great indicator for a well-run system. And I'm working really hard to have a well-run system. So that's what we're going to roll out to the three large networks as the stage one. And my intent is to get to roll out CONUS. And then we'll have to work with OCONUS, largely because of speed and time and lag and all. But we'll work that through such that they will have a similar capability to be able to make a virtual appointment. So that's one of our investments.
So, General, you mentioned a couple of times that you have a unique perspective and or a unique role in that you're a payer as well. And I want to talk about, before we get too far into it, TRICARE. I was hoping you could tell us a little bit about the plans, whether the Prime, Select, and TRICARE for Life. What does DHS? What are they doing to ensure that the users or the patients or the consumers have what they need?
Yes. So I'll describe our benefit, right? So we provide health care, as I talk quite a bit about the direct healthcare system, which is the hospitals we run. And then we partner with managed care support contractors, that's what we call them. And we do that in the space of healthcare delivery. Mm-hmm. So that's on the East Coast. I kind of break it up regionally like most patients would. That's Humana Military. And then we will have a change in our contractor on the West. So it's really about the middle of the country we divide it. And that will be Tri-West starting 1 January of 2025. And what they do is they grow a network of providers who take TRICARE as a reimbursement. And that covers, we take care of 9.5 million, and 2/3 of those do not get care inside of our direct run healthcare system. And so it is only with an integrated approach that we're able to deliver care to 9.5 in Humana and Tri-West. And then you have different kinds of plans. TRICARE Prime really gets to how much room you have and where you get care. You have a primary care just like any other healthcare plan. Mm-hmm. TRICARE Select allows you a little more latitude on choosing, but you pay a different premium to be in TRICARE Select. TRICARE for Life gets at our over 65 population that we are going to take care of, and we're able to take Medicare dollars, right, for the over 65 like other healthcare systems. The fun part of the job, I think, for me is that we're responsible for all of that. Mm-hmm. And so we get to think through, where does it make sense for the patient, for the human being, to get their care? Sometimes it's inside of our healthcare system. And so working with Humana and Tri-West to make that seamless and easy. So you may have a primary care doctor, and let's pick, I'll give a good example. We had a patient who gets their care in the community, remote from our hospitals or clinic, and they needed a neurologist. And the wait for the neurologist was fairly lengthy. And we had a neurologist outside of one of our military hospitals that actually had a specialty in what that person needed. We were able to coordinate that, and through a virtual encounter, took care of the patient with the family present and their primary care doc, and delivered really great care that was quality for that individual. And so I am excited about leveraging opportunities to integrate the direct and the purchase care in a more deliberate way, but always at the center of taking care of the individual, literally on their terms, right? Yeah. So some folks say, I really want to sit across from a doc. Okay, then we have a contract to help you get an appointment to sit across from your doc, but we want to create a range of options that provide care. We also have a very robust pharmacy benefit, and Express Scripts executes that for us, and that's one contractor for all. The same thing for dental. We have one contractor for our dental plan. And then we have TRICARE International, SOS, to manage our contracts for provider care overseas, both in Europe and in the Indo-Pacific. And the last thing I want to say is the TRICARE contract supports all 9.5 million. So when I've lived in Europe and in the United States, there are times that I will get my care outside of an MTF, and we use the contractor to help identify where we're going to get our care to a quality standard, the reimbursements, and so forth. I can't miss the opportunity that we're going to have open season coming up. 11th of November, we'll have open season. And for our large part of our beneficiaries, nothing changes for them. As we switch contractors, we are laser focused on decreasing any turbulence to the point where TriWest is looking hard at making sure they assume some of the same doctors so that you don't have to change. So we're doing everything to make it as smooth and transparent to our beneficiaries. The big thing that I need for beneficiaries is like anything else. If you're paying by credit card or a debit card, when you move to another contractor, you have to update that. We just can't take your payment information and all. And so we just ask, there's a security reason. So we just ask that if you're going into TriWest and that you want to stay TRICARE Prime or TRICARE Select, if we just please make sure that your payment information is current under TriWest, that would help a bump. But we got a plan if there's a misfire to help you through that.
Are there any other accomplishments, maybe it's around research, maybe it's around patient delivery, that you want to talk about that maybe we didn't touch on? And then maybe you could bring up what do you think the future is for DHA?
Yeah, so the things I didn't talk about, and there were a lot, right? Because when you asked what was my biggest surprise, and I said how much you've got to be agile and change how you think. It's because the organization is so large. It's large, and it's diverse, and our portfolio is broad, and there's a ton of talent in it to grow it. And so, what we do in the area of both public health and research is significant. And so our public health teammates, we've got MPOX. We have got environmental, looking at how do we position ourselves to be able to leverage data through sensors in an environmental way to keep the force healthy, to keep them prepared, and also to respond when they're affected. So definitely working in that space, whether it be blasts, right? Traumatic blast injury research and programs going in that space. And so I talk quite a bit about the healthcare system because we call that the gorilla. But I would want all our listeners to appreciate that the agency does a lot across a very broad portfolio in the space of health and now well-being. So where do I think we're going? I tell the team that the strategy is to plant the seeds to get us on the right trajectory, and the challenge you'd ask me was making sure you're planting the right seeds first. And that's really hard because there is no roadmap per se for what I've described where we're going. But I am very excited and confident that we have planted some key right seeds. And those seeds are some investments in the right technology that allow us to grow the culture and the mindset that's really going to move us to a process that says this is much more about being ready for anything versus preparing for everything, and that really it's a wave point. It's not an end state, right? So getting the wave point, and I've set a wave point for us to move from a fee-for-service model to truly getting to a value-based model where we are caring about human beings along the continuum of well-being to illness. And I believe as we continue on that journey, there'll be other things we'll layer in. We'll get better. We'll get faster. We'll see it broadly. In the area of research, I just think data with machine learning, and I wish it was called augmented intelligence and not AI because we battle with that. But responsible, there's just enormous opportunity there to truly get to our why. And why I personally went into healthcare is to take care of human beings, to make sure that they get the best care, that we're accessible, and that is personalized, that is individualized. So I think I know the agency, I know that's what we're driving to, but I also think healthcare in the United States will start to move closer to a value-based healthcare system as we are able to leverage. But we just got to be willing to make that cultural shift.
This has been the Business of Government Hour, a conversation with Lieutenant General Telita Crosland, Director of the Defense Health Agency. Be sure to join us next time for another informative, insightful, and in-depth conversation on improving government leadership and its effectiveness. Until then, subscribe, download, or listen to the entire interview at Apple Podcast, Spotify, Audible, or on your favorite podcast app, and as always at businessofgovernment.org.